As an RN, I was making close to six figures because I was working them overtime. Now as an MP, I'm making over six figures and don't have to work overtime.
Hey everyone, welcome back to my channel. My name is Nadia, and on my channel I focus on personal and professional growth and development and also nurse entrepreneurship. So now that I gave you guys a little bit of background on myself of how I work from home making six figures, and I also gave you guys some gems on how you can pay off your student loans if you have nursing loans, I want to switch things up a little bit. So I'm going to start a segment where I bring experienced nurses on to kind of share their experience as a nurse and exactly what it is that they do. For some of you who may be a nursing student, or if you're a nurse and you're looking to venture into different opportunities and you want to hear someone else's personal experience of what they've been through and what exactly it is that they do. So that's what I'm looking to share with you guys. So this week, the first week, I have a good friend of mine, Nadia. She is a nurse practitioner and she works in a school setting. So there may be someone out there who aren't familiar with this particular role of a nurse practitioner in a school setting, and that's why I wanted her to come on just to share her experience and what exactly it is that she does. This is really out of Nadia's comfort zone, so I really appreciate her taking the time to come on and share her experience as a nurse practitioner with you all. I'm in Atlanta and Nadia's in New York, so we're going to be having the conversation via Zoom. I'm hoping that you guys will find the information valuable and insightful for someone, again, who's looking to be a nurse practitioner someday or even considering the role and may not know of the different settings that they can work in. Don't forget to hit the subscribe button and give a thumbs up if you like this content. Again, feel free to ask questions below for myself or for Nadia, and I'll try my best to answer each and every one of you guys' questions. So let's get into the video.
Well, hi everybody. Thank you for having me, Nadia, and happy birthday. Let's not forget today's your birthday.
I really, really appreciate you doing this. So the first question I have for you is, how long have you been a nurse?
To answer your question, I've been a nurse now for almost 11 years. September 14 will be 11 years.
It just seems so surreal, honestly, when I think about it. Just remembering nursing school and just being here 11 years later and just seeing how far we've come. So Nadia, tell us a little bit about your nursing journey.
So I attended Pace University where I met you, and we became really good friends and study buddies. And then during my junior year, I had applied for an externship working at a local hospital where I lived. And during that time, I was fortunate to shadow a nurse for, I want to say it was for the summer. And after completing the externship, the nurse manager was very encouraging. She was very supportive. And she told me that when I graduated that she would give me my first job. So initially I was like, wow, like I was amazed that, she wanted to give me that opportunity. A year later, she actually reached out to me because she was calling me after finding out that I graduated. And she was like, Nadia, did you take the boards yet? And when are you going to take the boards? And at the time, I had scheduled the test, but I wasn't telling anybody. So I was just like, when I pass, I'll let everybody know. So after taking the test, she was one of the first person that I had called. And after that, September 14, 2009, I started my first nursing job. And I was a medical surgical nurse working nights for about 4.5 years. And during that time, my mom encouraged me to go back to school. She really wanted me to get my master's. So I started working on that while I was working on the medical surgical unit. And then shortly after, I transferred to the MICU, where I spent another 4 years or so as a critical care nurse. And while I was there, I had, graduated MP school, and I started working at an outpatient GI clinic for about 1.5 years. And currently now I've been working as a medical provider at a school-based health clinic for about 3 years.
You've been in a number of different settings, from the med-surg to ICU, from ICU to transitioning into being a nurse practitioner in a GI setting, and now to being a school setting. Your resume is pretty colorful as far as the different places that you've worked in. So what made you decide to be a nurse practitioner of all the different advanced practice areas in nursing? nursing?
I always knew that I wanted to work in the healthcare field. Um, I was torn between becoming a nurse or to become an OBGYN. But when I thought about, all the schooling and all the money, I just didn't want to take that route. And, I was like, dear God, there has to be another way. So when I decided to go back to school, I did my master's in family health, which still gave me that opportunity to do women's health as well as working with the pediatrics population, geriatrics population. So it still gave me an opportunity to work within the women's health field.
And I think that's one thing that a lot of people don't know, the different type, because I don't know this as well, the different types of nurse practitioners. If you have to really focus on one specific area, or once you're a nurse practitioner, then you can pretty much specialize in whatever specialty you want to specialize in.
So, well, the degrees they're a little different. Like if you decided that you wanted to be like an acute care NP, then it's just one track on that, or it will be like adult and geriatric acute care NP. If you decided to do family, which is what I did, because I remember someone telling me that you don't want to restrict yourself to just doing adults and geriatric and just acute care. So they suggested doing family, which would open up my opportunities to work in specialty, work with the different age groups. So that was the course that I decided, and it made me more marketable. Like I mentioned, I worked in the GI clinic, seeing adults and geriatrics, and then now I'm working with the pediatric population.
Oh, I think that's good to know, because honestly, I'm a nurse and I didn't even know that myself. So I'm sure there's people out here who don't know that there's different, once you're a nurse practitioner, there's different specialties. So how was your transition from RN to NP?
Well, to be honest with you, a challenge that I faced was the feeling of just being thrown into like the lion's den. On the first day, on my first day working as an NP. Exactly. And as an RN, when you start, you have orientation, you have a preceptor, and then you're precepted for X amount of time. And then afterwards, they kind of cut the string, tell you to fly, shoo-shoo, well, not shoo-shoo, but they,
they kind of hold your hand a little bit.
Yes, and they, allow you to become your own nurse. So I was under the assumption that I would get something of that, something along that lines, not necessarily for the same length of time, but I guess the expectations that they had for me was come in, fly with minimal assistance or guidance on my first day. So that was
that's frightening.
It was a shock. But when I did, I advocated for myself, and I spoke with the physician and also my director at the time, and I expressed that, and they were able to accommodate that for me.
Okay, good. And I think that's important as new nurses, as new providers, as new anything, that we need to learn to find our voice, because people will take advantage of you if you don't speak up. So that's very important that you were able to recognize that issue immediately and to voice that, and see they were able to accommodate you. How did you get into school nursing?
So after working nights for a very, very long time, probably like 8 years in total, and then working at the GI clinic, I had 2 jobs at the time, and I had a toddler. So I just knew that this is not working out. I don't want to work nights anymore. I want my weekends. I want holidays. So anyhow, I started stalking the intranet with the job listing for the hospital that I work at. And I saw the position at the school-based health clinic. And, I applied, and
here we are. Nice. So what is your schedule like as a school nurse? I know you said you wanted your weekends off, you wanted holidays off. As a school nurse, are you off for the whole summer? Do you follow the schedules of the teacher? How does that work?
So we do follow the DOE schedule. So we are off for the federal holidays, as well as some of the, not some, but the school breaks that they offer. So that's like Rosh Hashanah, what are,
Mhm.
Yom Kippur, then the midwinter recess, spring break, etc.
Wow.
So, and then the summer. So we kind of have the option to either work some of those days or not work them and then be off in the summer, or work the summer and then be off during those breaks. So I kind of, find a balance between the two so that I can have majority of the summer off.
Because I know you have like a month, usually like 6 weeks off in the
I
summertime.
sure do. It's coming up. It's coming up. I'm waiting.
What do you do as a nurse practitioner in a school setting, and how is the school setting different from, say, a clinic or something like
I
that?
work in a school-based health clinic providing preventative care. We do immunizations, acute care, reproductive health, and we also assist and aid in the management of some chronic diseases that the school-age population have, which are asthma, diabetes, or obesity. And our clinics are located in elementary schools, junior high schools, some charter schools, and then also high schools. Now, the difference with our clinic and a regular clinic is that um, outside, outside people or the people from the community aren't able to walk into the clinic for services.
Oh, okay.
So in our clinic, the parents or the guardians have to enroll the child, regardless of whether they have insurance or not. Once they would want them to be seen in the event of an emergency, or if something acute happens, to receive the care, they enroll them, and then that gives us permission to provide care for them. So in the event that mom is unable to bring the child to the pediatrician because they're sick, or something happens, or if they're sick during school and can't get an appointment, they can come downstairs and we'll see them. So we'll provide the care for them while they're in the school, because our goal is to keep all the kids in the school, coming to school, healthy kids, learn better, better attendance, etc. And we also aid those families who don't have medical insurance, or the newly migrated population to get an insurance. So we assist them and help them with getting that done. And then we kind of help them to connect with the services that they may need within the community.
Wow, so you do quite a bit. You play many different roles other than just, because I was thinking just primarily vaccinating, or if the child comes down and they have a stomach ache or something, you just give them some medication or for the stomach ache. But it's quite a bit that you do. I guess I never really understood or went into much detail as to what your day-to-day activities actually look like.
Yeah,
So,
we're treating the whole family as
mhm,
well, not just only the child, but the entire family as well, in terms of services, if they need it, or just seeing what kind of support that they may need,
mhm.
especially based on the communities that our schools are in.
So it's not just the health aspect of it, but
Yeah,
there may be social issues that need to be addressed
the
as well that
psychosocial
you
issues.
may
Yep.
need to assist with. So I know this is a question that a lot of people ask. I'm intrigued as well to know. So how different is your salary now as a nurse practitioner versus your salary as an NP? For everyone, I know you're in New York, so New York salary is usually very um, lucrative in comparison to other places. So before Nadia answers that question, it's good to know that demographics has a lot to do with the salary expectation. So just be mindful of that when Nadia throws out this huge difference. And I'm kidding.
Well, as an RN, I was making close to six figures because I was working them overtime. I was working all the overtime because at the time I was trying to pay off my student loans. So I was doing like 2-3 extra shifts a pay period. So I was coming in to, very close to making 6 figures.
Wow.
Now as an MP, I'm making over 6 figures and don't have to work overtime. So, so for me, that's the plus.
Nice. And you have your holidays, you have the summers to spend with your daughter. So
There's no fighting over the seniority. Oh, I've been here since before you were born, and I'm taking all the vacation, and then, I end up getting stuck with, I don't know, vacation in January, February, times that nobody really wants.
so what words of advice do you have for nursing students who possibly want to venture into being a nurse practitioner one day, or even those people who they want to do nursing but they don't know of the different areas that they can venture into?
So I do have 2 advice for the future MPs. The first one is that if you've never worked as an RN, I would definitely encourage you to, and it doesn't have to be long. You don't have to work there for, more than 6 months to 1 year. But, with you working as an RN, I feel that one will appreciate like its foundation, because without being an RN, you're not a nurse practitioner. They don't go separate, they go hand in hand. You need both of them to, do your job and to qualify, to do your job. Also, another thing that, I would want to advise future MPs is that, make connections, MP mentors, whether you're, reaching out to a class higher than you, or even with the teachers, as well as now they're offering some residency programs for MPs, where just like a doctor, where they have their fellowship, where they will go into a facility and, pretty much work beforehand to gain all of the experience. I feel that that would help also with the transition into the field. Also, if you're working for an institution that pays for you to go back to school, definitely jump on it and definitely go to school at their expense, because in the end, you're going to be giving back to them anyway and the community that you live in and serve.
Being that you brought that up, did you want to mention that, or did you want to share that experience? Because that was how you were able to go back to school, because your employer at the time, they paid for your tuition.
Yes.
100%.
100%. So yeah, I was definitely fortunate for that. And when I found out, I was like, okay, I mean, my mom was in my ear. And at the time I was like, I don't know, I'm already dealing with my loans. But then when I heard that they're paying for it, I was like, this is too good to be true. So let me try it. And then I did. And sure enough, my MP program was about 3.5 years, because I did it part-time, and they covered it all. And I walked away with no debt from that.
Wow. Well, thank you, Nadia. Thank you for coming on and sharing your experience with us, your journey into a nurse practitioner, and sharing briefly your role as a nurse practitioner in a school setting. Again, you're my girl, and I truly appreciate it. Thanks so much. If you guys have any additional questions for Nadia, feel free to leave them below. And she's not on social media, so ask me the questions in the comments. And if it's one I can answer, I will gladly answer the questions. And if I can't, I can always reach out to her and get the answer for you.
Thank you for having me.
I appreciate it so much. Have a good one.
You too.